We're here to talk about HCBS today. And Julie and I have two special guests. First of all, we have
Ooh.
Julie's but more importantly for this conversation, we have Jessica Ross, who has been working for more than 2 decades in HCBS. And we wanted to pick up this topic. We were like, Jessica is the person that we need to invite to chat with us today. So Jessica, welcome. Do you mind telling us a little bit about some of your experience and work in the HCBS space?
Yeah, thanks so much, Marie and Julia, for having me. I've spent the better part of 20 years helping CMS states and other organizations monitor and evaluate HCBS policies and programs. So very happy to talk more about that and the data that underpins them.
Awesome. Thank you. My first question before Julia digs in on the data stuff is just like taking a step back and putting HCBS in context. It's an acronym that gets thrown around a lot, but if somebody at home is not like super familiar with that acronym, what are we talking about? Because this is a super important part of the Medicaid program, and that acronym like holds a lot in terms of what's important in Medicaid.
Yeah, so HCBS are home and community-based services. So it sounds exactly like what it is. They are medical and personal care services delivered in your home or in a community setting. And they can include things like nursing care support, personal care support to help with activities of daily living, things like bathing or eating or dressing support. Over the past few decades, there's been an effort to really support Medicaid beneficiaries with these types of needs in the community, in their homes, instead of in institutional settings. And so, some states are providing that through fee-for-service delivery methods. Others are using managed care systems. But, overall, as you said, it's a very big component of most states' Medicaid programs.
Jessica, one thing that I have been thinking a lot about recently is this idea that when we look at data, we see the things that we pay for. And that can make it very hard when we're looking at services that are not necessarily paid for on a traditional fee-for-service basis. So this is especially true, I think, for home and community-based services. So I think about things like adult day care centers where somebody goes for a full day. You're not going to see a bill that says this person did this thing and this thing and this thing and this thing. I'm curious, like, how does that make data work more interesting, more challenging? How does that play out?
Yeah, it's a great question. And to your point, Medicaid is the biggest payer of HCBS. So Medicaid data, Medicaid claims are really the foundation of understanding what's happening with HCBS delivery. But Medicaid data alone are not going to tell you the full story. First of all, you need Medicare claims too. You need state-funded claims services. But then also you need more information that really tells you why those services are going to be effective or not. For example, housing is a really important issue in ensuring that someone is thriving in their community. And so you're not going to understand why someone's services that you're seeing in Medicaid data are effective or not unless you know that they're also stably housed, for example. And that's not going to be in any claims data. Similarly, to your point, the ultimate goal of HCBS is to ensure that people can participate in their communities. And we don't know from claims if the services provided are actually enabling that person to go to their church, to go to their community center, to go to their school, etc. So you really have to bring in and integrate a lot of different data sources to understand the full picture of what's going on.
Which is an interesting segue into why HCBS has been in the news lately, which is because there's been a lot of attention on these types of programs and services from a fraud, waste, and abuse perspective. And Julie and I previously in prior versions of this conversation have talked about just in general why Medicaid is very hard to look at from a fraud, waste, and abuse perspective. And part of that is the data, and part of that is the relative immaturity of some of the, we're looking at it less than we have Medicare. But we wanted to talk to you specifically about that in the context of HCBS, because I think we just named that, like, even like Medicaid being a complex area to look at, just like at a baseline, there's a bunch of reasons why HCBS is maybe even harder, right? So
Yeah.
can you dig into that a little bit? Just like, knowing there's a ton of scrutiny on these programs right now, like states are really actively thinking about this, and the data's hard here, right? Like what's happening in this space right now?
Yeah, it's a great point, and I do think, HCBS, it's by nature a diffuse system, right? You don't have a single provider that you can look at and say, oh, I understand the whole picture. You have to integrate all those different services and, parts of program operations that we were just talking about. So I think it is more challenging to really sort of characterize what is happening and then concurrently identify cases of fraud, waste, and abuse, for example. I also want to note that I think most of us who work in the HCBS space would want to recognize that HCBS program integrity is about much more than fraud, waste, and abuse, even though that's gotten a lot of attention. And I'm sure there is some fraud, waste, and abuse out there. There's fraud, waste, and abuse everywhere, no matter what financial program you're looking at. So that is a reality. But HCBS program integrity is really about, or it should be about, whether the services provided actually meet the goal of helping a person stay in their community, thrive in their community. And I think of all the people I've worked with over the past years, everyone wants that to happen. And the start of that is really understanding your data. We need to begin by looking at data quality. Are we seeing information that doesn't make sense? Are we seeing things that might be a data entry error, or there's some outlier values, for example? When these issues are concentrated in, say, one person or one geographic area, people served in a certain region, or by one provider and things like that, that's the beginning of a conversation to me about program integrity. Many times when we look into these issues, we find that issues like these are, random error or resulting from confusion about how to report correctly. But it can also be a signal that maybe we're not using best practices to accomplish the goal. So it's taking longer, for example.
Yeah.
Could also mean that the member has really complex needs and they are getting there, but it takes longer. I think we all know that healthcare is not a one size fits all scenario. We've all been in that position, and that's even more true when it comes to HCBS. Occasionally, of course, there can be instances of fraud, waste, and abuse happening, and that's important to acknowledge. But I really think this renewed conversation around HCBS program integrity is an opportunity for all of us who care about making these program works to dive into the data, understand what's happening, and really bring those best practices forward.
Jessica, that's a really interesting and beautiful way to frame it, right? And I think part of it is coming from this perspective of saying, like, doesn't have to be like a standalone separate initiative. In some ways, there is this like fundamental gap between the data we have and the services we want to be delivering, right? And that we want to close that, right? Like we want to understand what makes these programs most effective, because like it's a really good goal, right? And I think you're pointing out like one of the benefits of doing that is that we could see fraud, waste, and abuse more effectively, but there's many other reasons to do that, right? And that is that we can efficiently and effectively steward dollars to a very vulnerable set of patients, right, who we really want to benefit from these services. Is that fair?
Absolutely.
And Jessica, one thing that you said that is really sticking with me is just thinking about what outcomes we really want to be looking at. Can somebody engage in their community, in their home, the way that they want to? That is an incredibly difficult thing to measure.
Yeah.
I'm curious if you have thoughts about data that tell you that and can help you answer, are we achieving any of those outcomes?
Yeah, it's a great and timely question, especially given CMS's HCBS quality measure set is out there and does have a number of member experience surveys that are intended really to complement all this information about, you know, what services are being delivered, how fast are people getting access to services, this sorts of thing, with that member experience of, yes, I was able to get, you know, transportation to the grocery store, or yes, I had help when I needed it at home to do XYZ. So you don't have the full picture, especially in HCBS, without that kind of experience data.
Jessica, thank you so much for letting us dig into this. I think we've gone through as many questions as Julie and I always could like go for much longer than the time we have. Is there anything in closing you would want to offer? Or did we ask you all the big things about HCBS that feel relevant right now?
I think we've hit on a lot of them. I think, you know, at the end of the day, there's a lot of energy around HCBS program integrity right now, and sometimes that feels scary and overwhelming, but I think this isn't actually an opportunity for all of us to dig in and really ensure that these services are working for the people that need them. So that's my takeaway.
Thank you, Jessica. We'll look forward to having you back to talk about this more.
Yeah.
Sounds good.